Hey everybody, welcome back to Be Well with Doctor Stockwell. This is your host, Dianna Klein. I have the honor and privilege of being the CEO of Doctor Stockwell's, and I am here this evening with two absolutely incredible individuals. This evening we have Mrs. Nevada, United States of America, Amanda Klein with us today, and that's 2020, soon to be. Come February, she will be competing for the title of Mrs. United States of America, and I have no doubt that she will rock it. So I have her with us today. Welcome, Amanda.
Thank you. Fingers crossed.
Yes, absolutely. And I also have Amanda's physician and incredible doctor, Dr. Carrie Bedient of the Fertility Center of Las Vegas. She is one of our nation's leading infertility specialists. We just so happen to be fortunate enough here in Las Vegas to have her in our midst. And so both of these ladies will be joining me today. Thank you, Carrie. Dr. Bedient.
So nice to be here. Thank you for having me.
Absolutely. Absolutely. So want to give everybody, all of our listeners, a little bit of background about these two ladies, because I know they're both modest and they won't tell you all of their accolades themselves. So I'm going to brag on that. I'm going to start with Dr. Carrie Bedient. She is with the Fertility Center of Las Vegas, and she is Southern Nevada's only female board certified reproductive endocrinologist. She is also dual board certified in both obstetrics and gynecology, as well as reproductive endocrinology and infertility, with advanced training in minimally invasive robotic and laparoscopic surgery. Dr. Bedient's academic endeavors in the field of obstetrics and gynecology include studies at some of the U.S.'s most prestigious universities and medical facilities, including the University of Arizona, Emory University, and the Cleveland Clinic Foundation Metro Health Medical Center. It seems like the Cleveland Clinic is always like A+ #1, top of the top, every single time. So Cleveland Clinic Foundation Metro Health Medical Center, amazing location. There are several accolades to Dr. Carrie Bedient as well. Her accolades include Top Docs in Las Vegas 2018, 2019, and I'm pretty sure it'll probably be 2022. Mm-hmm. She's got my vote. Recent research award at the Pacific Coast Reproductive Society. She is an LGBT ally, and she received an award for her LGBT ally from the Touro Medical School. Pretty amazing. Also, she was invited to join the Gold Humanitarian Honor Society for exhibiting empathy, compassion, respect, altruism, and integrity in medicine. On top of all that, Dr. Bedient teaches at all medical doctor programs in the city, including the University of Nevada School of Medicine, Las Vegas Minimally Invasive Surgery and Women's Pelvic Health Center. I believe that includes machines such as the Da Vinci machine. I can't wait to possibly hear a little more about that amazing device during our podcast today. Additionally, she also serves the Las Vegas community as the Director of Reproductive Endocrinology and Infertility at the Mountain View Obstetrics and Gynecology Residency Program. Dr. Bedient's published papers and book chapters discuss frozen versus fresh embryo transfers, the use of robotics in reproductive surgery, adolescent fertility preservation, and a comparison of robotic and laparoscopic myomectomy. Did I get that? That's a big word. Did I get that right?
You got all the words correct. So
yes. Okay.
So impressed.
Awesome. Okay, good. So in her spare time, she does indeed sleep. She also gives back to the community, advocating for women's health initiatives. She also enjoys traveling, baking, crafting, and spending time with her husband and two young children, and taking walks with her dog, Gigi. Gigi. Oh, all those big words, and I messed. Oh, Gigi. Okay. Fantastic.
You nailed myomectomy and you nailed reproductive endocrinology. But,
shucks, I got to work on the dog names.
The 4 letters of Gigi, that's
it is. It is. Absolutely. Absolutely. Welcome, Dr. Bedient, once again. Thank you. So now I want to brag on our Mrs. Nevada, United States of America, Amanda Klein. So Amanda and I actually have a mutual connection. We both got our MBAs at the University of Nevada, Las Vegas. Additionally, she is a graduate of the University of Nevada, Reno. So she has both allegiances in her blood.
I do.
So yes.
I always win the game.
You do.
No matter basketball, football, I always win.
I love it. I love it. Yes, yes. Native Nevadan, she also attended Bonanza High School in Las Vegas and has desert sand running through her veins from the very beginning. So there are a few people more proud of the state than Amanda, and I'm so glad to call her my friend. But now I'm getting sappy. I'll get back to your accolades and your awards. So back to her honors, awards, and achievements. Amanda is the Director of Marketing, Individual, and Family of Anthem Incorporated. She is the co-chair and regional board member of the American American Cancer Society. She is an advocate for Resolve National Infertility Association. She is a member, City of Las Vegas 2050 Master Plan Citizens Advisory Committee. That's huge.
And fun.
Yeah.
It's fun to think about where we're going to be 30 years from now as a city.
Yes.
Yeah.
Definitely. It's amazing. Additionally, she was the recipient of the award, Vegas Inc.'s award for 40 under 40, most amazing people, 40 under 40. I know. See, she doesn't tell people this stuff. I know.
Stuff about you, Amanda.
I know.
Can you just remind me with the resume?
Of course. Yeah, of course. Blood sample, judge's bio, no problem.
Yes, there you go. So I'll discuss Amanda's platform just ever so briefly, and then Amanda, I'll let you get into that. But Amanda's platform for her pageant and also for her life is called Smart Barbie, and it's dedicated to the advancement of women in our society in all aspects. Additionally, in addition to her platform and all of her work with Anthem and volunteer work, Amanda has some really amazing career ambitions. They sound a little bit maybe like mine, perhaps someday. But Amanda hopes to be one of our future congresswomen, which I absolutely have no doubt that will happen. But she is an aspiring community servant, elected community servant, and I find that awesome. She's currently considering a board position with the Clark County School District, which would be amazing. And as far as a long-term career ambition, she would love to be the career marketing officer for a Fortune 500 company, which I totally see that happening too. So, and I love this. Her favorite quote is, "If you are successful, it is because somewhere, sometime, someone gave you a life or an idea that started you in the right direction. Remember also that you are indebted to life until you help some less fortunate person, just as you were helped." So true. That is by Melinda Gates.
Yep.
Wonderful woman.
Absolutely.
And that's exactly what you embody, Amanda, and that's what you're doing. So
thank you.
Once again, thank you for being here. So a little addition, if you're new to Be Well with Dr. Stockwell's, welcome. But if you're one of our followers, have listened to our 4 previous podcasts, you'll know that we're all about women's health. Yes, Dr. Stockwell's is a brand, and yes, there is a vitamin attached to that brand, but more than the business end, we are into also helping women make great choices for their health care and informing women about different aspects of our health. Because before I met Dr. Erica Stockwell, I had really no idea about my own pelvic region, shall we say. And so I am honored to have another specialist here whose brain that we can pick, and she can offer us some great information to our listeners to help all of us live better lives. So, but thank you again, ladies. And those were the intros, and we'll just get right to it. And Dr. Bedient, tell me a little bit about how you got into medicine, first of all, and then how you determined that you wanted to specialize in women's health specifically.
So I originally got into medicine I got interested in it when I was about 16 years old. And I had a boyfriend at the time whose father was a neurosurgeon, and I thought that was the coolest thing ever. So I got to shadow him in the operating room and see some procedures, and then went to college with the intent of going to medical school afterwards. I was an EMT on the college campus response team at Washington University in St. Louis, and then got into medical school. And when I originally went into medical school, by that point I had changed into thinking, okay, I want to do pediatric infectious disease because I want to do all of the really crazy things like Ebola and crazy parasites and all that. All of the gross stuff really is what it amounts to. And then once I got into my pediatric rotations, I realized that sick kids are heartbreaking, and parents of sick kids are just in one of the worst places in their lives. And so when I did my obstetrics and gynecology rotation, I just fell in love with it because the patients, for the most part, are healthy. They're in a wonderful position in their lives, and you get to be with these patients for years upon years because they come to you as teenagers trying not to get pregnant. And then as they get into their 20s and 30s, they are trying to get pregnant. And then you go with them through menopause, through just really their entire life. And so I thought that was wonderful. I loved the operating room, and I loved delivering babies, and got into residency. And as I got further and further, I'm like, okay, they cover too much. I need to know everything about something. And so I have the utmost respect for generalists because they know information about a very wide variety of topics. But what I really wanted to do was to dive very deep into one of them. And reproductive endocrinology and infertility is a field where you deal both with the clinical, talking with patients every day, often in very sensitive times in their lives. You have to translate a lot of very technical information into something that they can understand and grasp. Because this is, like most parts of medicine, you really have to be engaged in your own medical care. And the more that you know about it and the more you can really understand, okay, this is why my doc is telling me to take this medication, the more likely you are to actually figure out, okay, if I put this in a pill box every day and if I put an alarm on my phone, I'm actually going to take it because this is truly important. So I spend a lot of time with my patients explaining what we're doing, why we're doing, how we're going to get to the ultimate goal. And the other part of reproductive endocrinology and fertility, and from hereafter I'll call it REI because it's less of a mouthful.
Gotcha.
Not to be confused with any other sporting goods stores.
Nice.
But what REIs really do is they bridge that very clinical world with a very technical world, because behind our laboratory doors we have embryologists. We're constantly working with single cells to turn them into 2 cells, to turn them into 8, to turn them into a couple of hundred, to turn them into a human being. Wow. And so it is a huge range of technology, of science, of basic science, so where it's the cutting edge, because what we used to do 20 years ago is dramatically different from what we are doing today. Mm-hmm. And the success rates are phenomenally different. And so for the majority of patients who are coming in, some way or other, may not be the way that they originally intended, but some way or other, we can help them have a baby and help them build their family. And that is just the best thing. I mean, I've had 3 baby visits this week. I had a 2-week-old, I had a 7-month-old. The 2-week-old was a local baby. The 7-month-old was coming from Tahiti. And then I had she was 3 weeks old. Baby come visit me today. And her parents are in Spain, and they actually their gestational carrier just delivered.
Wow.
And so I have gotten so many baby cuddles this week, and you cannot replace that. Mm-hmm. I mean, the two biggest points that keep me coming back every day are, number 1, baby cuddles, and number 2, yes, the first time a new parent hears the heartbeat, because these are not just people who are kind of idly excited about, we got pregnant, we tried the first couple times and it worked. These are people who they worked really hard to get there. And so hearing that first heartbeat is just phenomenal. And so that's what keeps me coming back day in and day out, despite the tears, despite the heartbreak, despite long hours. It is worth it all the time.
That's amazing. That's amazing. So you, and I know offline before we started, we were speaking about how, Amanda, you had graduated from Dr. Bedient, and now you're going to, so at what point do people come to you, Dr. Bedient, and then at what point do they leave you and you refer them on to the next step?
So they come to me at a variety of points. Some of them have already been diagnosed with infertility, and they know exactly what's going on because their general OB/GYN has already been able to tell them, oh, you have blocked tubes, or your partner doesn't have any sperm, or not very much, or it's not moving, or you're not ovulating, or they kind of have an idea. Some of them have already tried some of the really basic fertility treatments with their general doctors. Some of them come directly to me because they find me over the internet, or they've been doing reading and they realize, hey, it's been a year and a half, like this should have happened by now. And so they come directly to my office. So people come at a wide variety of stages. And once they get there, we do a thorough evaluation. We want to check out the uterus, the tubes, the ovaries, the sperm, make sure that everything is part and parcel working, or if it's not what it is, make sure that their general health is good. And then from there, we progress with treatment.
Gotcha. Oh, amazing. Well, thank you. Well, we'll come back to you for sure. But Amanda, I would like to move on to you. And just to reiterate, I think I mentioned it briefly earlier, but Dr. Bedient is Amanda's physician. Yes. So that is one of the main reasons why I have you guys both here.
She's Wonder Woman.
Yes.
She's my superhero.
Yes.
She can put up with me. So.
Oh my goodness. You are not hard to put up with at all.
She asks some really thorough questions.
No,
really good.
No doubt.
The thoughtfulness is impressive. And the fact that she is always delightfully pleasant and polite is huge and phenomenal.
Oh, I bet.
I would do anything for this woman.
Oh my gosh.
But yeah, awesome. I do kind of come in like a journalist, like an investigative reporter.
How many notebooks have you had by now?
Oh gosh, I go through them almost daily.
I believe that.
Like,
Yeah,
you
I
know,
can
like
see that.
like a normal, like, white pad of paper, I could go through one if I'm super busy
I bet.
on the daily. Yeah.
Oh, I bet.
Yeah.
Oh, gosh. Well, Amanda, if you don't mind, could you share with us your story and how did you get to know Dr. Bedient and how did you find her and all that stuff? I know that's a straight with I know your journey and that's a big question and we could talk forever, but please feel free to talk forever. Tell us about tell us about your journey. Tell us where you were when you came to Dr. Bedient, where you are now,
Sure.
and where you're going.
Sure. So, my husband's name is Mark.
Ah, good name.
Huh. We're all married to Marks, but my husband's name is Mark too. And Mark and I were friends for a million years before we started dating. We're engaged within 10 months of when we started dating. And we thought when we got married in 2015 that we were just going to like put it out there to the universe that we wanted to have a family and it was just going to magically happen, right? Like that's the storm comes down scenario, right? We were immediately hit with the reality, the harsh reality that 1 in 8 couples faces today. That, you know, sometimes it just doesn't happen that easily. And sometimes there's something that needs further investigation. So we didn't know that right away. I got pregnant immediately, but then I miscarried. The first one in 2016. Right after I miscarried the first time, I found out a coworker was competing in the pageant world, in the Mrs. Pageant world, and I had gained some weight from the pregnancy, and I was not really feeling like myself. And so when I found out, I ran over to her and I said, "I know this is your personal life and not professional, but I need this in my life. Like, tell me all the things. I need to talk to the director, and I need to be on that stage as soon as possible." So that's when I initially started getting into pageantry, Mrs. Pageantry especially. So I competed that first year, and then we tried again the next year to have a child. And again, I got pregnant immediately, and I miscarried around 10 weeks. And the second miscarriage was actually the hardest because that afternoon, Mark and I were having lunch, and I said, "Mark, something's wrong. Something's wrong." And he took me to Summerlin Hospital, and I was starting to miscarry. And that day was October 1st, 2017. So it was the day of the shooting in Las Vegas, the mass shooting in Las Vegas.
Yeah.
And, you know, having worked in the hospital systems in Las Vegas and having known clinicians all over the city, and also having a lot of friends who were there at the concert and not being able to do anything because I was going through my own personal trauma was horrible.
Yeah.
Horrible. And so that was the hardest part. And then after the second miscarriage, we said, okay, the first time it's 1 in 4. The second time, something's going on. And so we initially did start working with other specialists in town. One specialist did recommend that we try it again naturally before starting IVF or any other further treatment. Same thing happened. We got pregnant right away, and then we miscarried about 10 weeks. And so that was really hard because it was like, I really wish I didn't have to go through that last trauma.
Yeah.
By my just crazy type A personality and the wonderful Dr. Nicole Moss said, "You know what? You need to go talk to Dr. Bedient at Fertility Center of Las Vegas." I said, okay, I'm going to do that. So I met with Dr. Bedient. We did all of the diagnostic testing, surgeries, and certain kinds of procedures, and we determined that I have a bicornuate uterus. That's also referred to as a heart-shaped uterus, which sounds so lovely, but it's not. And it's so extreme that one side is basically completely collapsed.
Oh, wow.
So women with a bicornuate uterus can get pregnant and have healthy pregnancies all the time. But for me, my birth defect, my condition is so extreme that it would be unlikely and unsafe, most likely, for me to carry to term.
Oh, wow.
So that's when we kind of said, okay, we need to hire a surrogate. We need to do IVF to get my eggs, my husband's sperm, and create embryos. And then we're going to put our bun in someone else's oven.
Yeah. Wow.
Yeah.
Oh my gosh.
So we did that. We did 2 rounds of IVF, And, IVF is hard. It's very hard, but it's also very worth it. And, there were moments where I said, I can't do this anymore. And, Dr. Bedient just had my back the entire time, was my biggest cheerleader, and I couldn't have done it without her. And she also, so we ended up having 4 embryos, three girls and a boy.
Oh,
which is perfect.
yes.
And
Mark is outnumbered.
I know. Well, he knew what he was getting himself into. And Dr. Bedient referred me to 3 different surrogacy agencies. I met with all 3 of them and just absolutely fell in love with U.S. Surrogacy, who I'm with now. So.
Oh, cool.
Yeah.
And you're with them now, and how far along are you with them
So this morning,
Yay.
we graduated, and what that means is that my surrogate is 10 weeks pregnant.
Awesome.
And will go from the specialist office to now a traditional obstetrician's office. So.
Oh, that's so
great.
great.
Through the diciest part.
Yeah.
So hopefully clear sailing from here.
Yeah, I'm cautiously optimistic because of everything we've been through. I've never had a good experience in the ultrasound room. And so we'd have our appointments on Thursdays, every other Thursday. And so on Wednesday, I've just been a nervous wreck. But there's no reason behind that. She's phenomenal. She's in great health.
Sure.
The embryo is in great health. It was just my personal experiences.
Sure, absolutely.
Yeah,
absolutely. Oh, wow. Can you tell us a little bit about like how you picked your surrogate, like the process behind that? You said you fell in love with U.S. Surrogacy.
Yeah.
So you interviewed 3, you found one, you liked them, and then what's the next step? What was the next step after that?
So Mark and I liken it to online dating, like
extreme version,
extreme online dating. Like,
version.
do you like me? I like you. We got super, super lucky because our surrogate is here in Las Vegas.
Oh, that's great.
I know. So we don't have to bear the burden of the cost of travel, because we are, business women, and I am a very type A personality when it comes to finances. I was deathly afraid that I wasn't going to be able to afford surrogacy as well. Yeah. So we found a local surrogate who fit within our budget, and, meeting her, we did a video conference or a video chat before we met in person. And she's just wonderful. Like, okay, so I won't cry yet about my baby. I will cry about my surrogate. Like, she's like a godsend, and she's a rock star, and she's super smart, and she's going to change the world. And yeah.
Oh, that is so cool.
That's all I'm going to say.
That's amazing. That's awesome. Because I've heard, and perhaps this might be an old wives' tale, and I'm sure it probably maybe is. I don't know, Dr. Bedient, maybe you can shed some light. But I have heard that oftentimes, a dear friend of mine back in the day, his sister-in-law carried his wife, he and his wife's, was their surrogate.
Yeah.
And he swore that there was some, not DNA per se, of course, but just characteristics of both in his child. And of course it could be familial related, but it would make me feel better knowing that if I had to have a surrogate, that my surrogate was a rock star too.
Oh,
like
absolutely.
That would be good peace of mind.
There is an influence on how the genetic code is expressed by the woman who's carrying the pregnancy.
Oh, wow.
And what we have found is the vast majority of surrogates, there is a special level of kindness and generosity and just general goodwill in their spirit, because while many of us can carry pregnancies, most of us are not so generous, even when paid, to do it for another couple, much less another couple that we don't know closely.
Right.
Sure.
And so when you see these surrogates come through, they have to jump through huge hoops to make it through, not only someone who's as type A as Amanda, make it through her screening, but they got to make it through my screening too.
Okay.
And so there are huge hoops that they've got to jump through. And to have the willingness and dedication and intelligence to get through it is huge.
Yeah.
So you mentioned that when they come to you and fit through your screen as well. So was that an official part of the selection process, or was that preferred by you guys to have her come in? Like,
it's part of
it's part
process.
of it.
It's required.
Yeah.
Yeah.
It's amazing.
For any place that has been doing this, you have to go through the screening, and it's pretty comprehensive. We request all of her medical records. One of the docs in our office goes through them. She comes to our office and we do a full history, a physical, a special sonohyst, which is an ultrasound where they put water inside the uterus, and then I actually look and make sure there's no current occupants of the uterus, like a polyp or a fibroid or anything like that.
Wow, sure.
8, 9 vials of blood. It's really, they go through a psychological screening. It's pretty thorough. And they've got another layer from what the agency does as well, because they're going through, does she have a reasonable credit check? Does she have a criminal record? Does anyone in her house have a criminal record? I mean, it's very thorough before we'll let somebody have the privilege of carrying someone else's baby, because it is a privilege to do that. I mean, you're being trusted with the most precious group of 300 cells in someone's life.
Yeah.
Oh my gosh,
Yeah.
yes. Geez, I had no idea it was that involved. Makes perfect sense that it is, and it should be. That's incredible.
Well,
Wow.
I've had a lot of people ask, like, because they know I'm crazy, and they're like, so, like, are you like parked outside of her house? Like, are you telling her what to eat? Like, are you telling her to eat organic and blah, blah, blah? I'm like, no, I'm not going to tell another woman what to do with her body. That would be like if someone told me what to do with mine. I'd be like, I think you're funny. Yeah. So, yeah, it's crazy. And I have full confidence because I have such an amazing team.
Yes. Yes. Oh, that's so exciting. Okay, so you're 10 weeks
10 weeks.
today. Yeah. So due date is
August 5th.
Oh my gosh.
I know. I know.
That's so cool. Oh, I'm so
year.
excited. I'm so excited. Oh, well, neat. So I noticed too, Amanda, and you and I have talked about this, and I remember when you went to DC last year. What a cool experience. Okay. So you went to DC, you went down the halls of Congress. I think you met with Representative Susie Lee from Congressional District 4 here in Nevada. That's amazing. So tell us a little bit about the lobbying that you have done, and if someone wanted to get involved with Resolve, which I understand the lobbying is through Resolve. Right. Is that correct? Okay. Right. So how would they get involved?
Resolve is the National Infertility Association. So they lobby both at the state and the federal level, but they have an annual event. It's their advocacy day, and it's usually the third week in May in Washington, D.C., and they have delegates from all over the country fly in to meet with their state representatives, or their state representatives in the Senate and the House. And in a state like California, they would have 20, 30 delegates, so they couldn't even all sit in a room together. Whereas in Nevada, Mark and I were the only people from our state.
Oh, wow.
So, I mean, I had 30 minutes with Congresswoman Lee, and I met with Cortez Masto's office, and I met with Jackie Rosen's office, and they were also wonderful, and they actually ended up co-sponsoring. They all co-sponsored one of my bills.
Oh my goodness!
Yeah, or one co-sponsored in the Senate, and then Susie Lee co-sponsored in the House, and it was about equality for adoption. So we're making big moves at the federal level. I am also providing testimony next week to the Nevada State Legislature's Committee on Health about the adoption of a bill at the state level, which can be very challenging with the Affordable Care Act. Infertility doesn't fall within the essential health benefit, not to get too technical. But, there are certainly things that we can do, even just starting a conversation to say, there's 60,000 women in the state of Nevada at this very moment who are either struggling to get pregnant or carry a pregnancy to live birth. And that's staggering for a state our size. Yes. So, something needs to change.
Yeah, absolutely. Absolutely. Amazing. And just to reiterate, it was Resolve.
So you can go to resolve.org to learn more, both at the state and the federal level.
Okay. Yeah. Oh, awesome. We are almost to the close of our time, ladies. So as far as parting thoughts, and Amanda, your journey has been incredible, and I love your mark to death. Of course, I love mine, but I love your mark to death. And I mean, can you tell me a little bit about your Mark and how important he is to you and what he means to you and how he's been by your side this whole time? Tell us about your dude, your fella, just a little.
I got super lucky.
Yes.
I got super lucky. I have to tell you, I've heard so many, real talk, I've heard so many horror stories about women who have said to me, my ex and I went through infertility and that's why we're divorced. It started all of these relationship challenges. And, It is so easy, especially as women, where we put so much pressure on ourselves to be perfect all the time. It's so easy to say, I'm damaged, I'm broken. Why did my husband even marry me? Because I can't do the one thing that we thought we were going to be able to do as a couple. And first of all, my number one message to anyone who's going through infertility is you're not broken. You're perfect exactly the way that you are, and you will find your path to parenthood the way that you are meant to, however that shapes up. But Mark has been my biggest supporter since day one. I remember there was a point during IVF, and he looked at me and he was like, I can't watch you do this anymore. Like, I can't. And I said to him, I appreciated that more than anything in the world, because it showed me how much he loved me and how much he cared about me. But at the same time, I was like, it gave me the strength to say, no, I got this. I can do it,
Oh, yes.
And my husband, my family, they have been such a huge support system for me. And I couldn't do this without them.
Yeah.
So.
Oh.
You got me.
I know. No, I'm
me.
gonna get gotten too. No. Okay, so for those of you guys who are not watching the video, we're sitting here, we're tearing up, and yeah. So I'll move on to. I'll finish with a happy question. You're sitting here in your gorgeous crown,
which is why I keep fidgeting, because a crown and these headphones.
I know.
I'm like a bobblehead right now.
Well, you're doing great. It looks
you.
magnificent.
Thank you.
So you're sitting here with this beautiful crown and this amazing sash, and you told us a little bit about how you got into pageantry. And you're a Mrs. and I'm a Mrs. Yes. We're all Mrs. Yes, there we go. And I know before I met you, I didn't even know that a Mrs. division existed. I knew Miss America, Miss Universe, but that was for the ladies who have a few less years of wisdom under their belts than perhaps we do. Let's put it that way. There we go. But tell us a little bit about pageantry, and what would you, let's say that one of our listeners is one of a fellow Mrs. Who finds this intriguing. How would she get involved in pageantry? What's the first step? And what advice would you give?
I would say reach out to a state director. You can just Google around Mrs. fill in the blank, whatever state you live in, Mrs. Nevada. My system is the United States of America pageant, USOA, Mrs. Nevada, and we are recruiting right now. We are certainly looking for people who are interested in 2021. But you know what? I think the biggest advice I would have is just, if it scares you, that means you should do it.
Absolutely.
Because it gets you outside of your comfort zone. I believe more so than anything, pageantry has changed the trajectory of my life and has given me the confidence to do things like potentially run for public office one day and be a servant of the community, because I've just learned so much about who I am as a person. I've developed this confidence within myself to say I can take on just about anything, and I love being an advocate for other people who don't have a voice.
Yes.
Especially women.
Awesome. Oh, thank you, Amanda.
Thank you.
Oh. Dr. Bedient, let's say that some of our listeners are in the situation that Amanda and Mark were in. They're looking for answers, and if they so happen to be fortunate enough to live here in Las Vegas, because we all love Las Vegas, or even if they don't, even if they want to come in and find you, how would they go about making an appointment with you, going through the referral process? What advice would you give to folks in Amanda and Mark's position to get the proper care?
First thing is just to start by coming in, and it sounds very simple, but it's a huge step. We have a great website. It's set up. You can request appointments there. It's got our phone number, which is the 702-254-1777. I think I got that right. And in the Fertility Center of Las Vegas, you can come to our website, and we've got an online form where people fill out, okay, this is what I'm doing and this is what I'm looking for. And we have patients who are spread all over the world. I mean, I mentioned earlier, I've attended parents from Spain. I also have from Australia, quite a few from France, small islands around the world, quite a few from China. I mean, really, truly, I think it's 35 countries as a current tally, as well as all over the United States. And the first step is to make the appointment. And once we have that appointment, we just start doing little by little. And the old joke is, how do you eat an elephant? Well, the answer is one bite at a time. And so you just go little by little. And part of my job is to give you the information that you need. The other part of my job, which is more informal, is to give the pep talks. And I remember looking at Amanda and hearing hearing Mark having said, I can't watch you go through this, and looking at her going, we're not done yet. I know when I can look at a cycle and go, okay, it's time to cut ties and to move on and to do something different. But also we know when you just need to keep pushing and we will get there. And so a lot of it is just make the phone call, come in, sit down, and we'll just start going through things. And I really don't care how many times I have to explain things to people because I want them to understand. And really you gotta sit down with me, whether that's by phone, by Skype, or in my office, and we'll just start working through things. I got a huge compliment from one of my patients today who said, you give the best hugs. When I went through that was
that's awesome.
Your hugs just get me through it. I look forward to your hugs every time I come into the office.
That should be the first bullet point of your bio is
I give great
amazing hugger. Yes.
Oh, you need a t-shirt.
That's awesome.
Always.
Oh, amazing. That's great.
It's part clinician, it's part scientist, it's part cheerleader.
Yeah.
And so, but if I don't see you, I don't know how to help you. And so a lot of it is just calling. And I have a lot of people who come and see me and they sit in my little white chairs, and my staff jokes that my chairs are bad for business because people go home and then they get pregnant and they call us back with spontaneous pregnancy tests. Note, not in my chairs at that time.
Okay, good. Excellent.
Woo! In Las Vegas, but it was not that kind of
Oh, that's awesome.
We'll sit down and we'll talk, and if you don't need me, that's wonderful. I'm not offended by people who do it on their own and get pregnant on their own.
Right,
but
right.
Most of the people who come to my office really need a little bit of a boost.
Yeah. Awesome. Dr. Carrie Bedient, Mrs. Nevada, United States of America. Amanda Klein, you guys, thank you so much for being here. It's been an absolute pleasure for me to just sit here and absorb all of this good and all of this fantastic energy. So thank you guys. Stay tuned. There's more to come, and thanks again for subscribing. Have a great day, everyone.